Hey everyone, it's Vicky here again. And today we're talking about something that happens to all of us, cuts. Whether it's a little nick while cooking or something more serious. Knowing how to handle a cut properly can make a world of difference. Cuts, also known as lacerations, are a common type of wound that can range from minor to severe, depending on their depth, size, and location. Proper wound care is essential to prevent infection, promote healing, and minimize scarring. Here's a comprehensive guide on handling cuts in wound care. We'll go step by step through the process so you can feel confident and prepared the next time you need to treat a cut, whether it's on yourself or someone else. Let's get started. Alright, first things first. We need to stop the bleeding. This is crucial because uncontrolled bleeding can lead to shock or other serious complications. Seeing blood can be a little scary, but remember, our bodies are pretty amazing and often start the healing process immediately. Blood clotting is one of the body's natural defenses against bleeding. The first line of defense when you get a cut is direct pressure. This helps to slow down the blood flow and gives your body a chance to start clotting. Grab a clean cloth, ideally sterile gauze if you have it, and press firmly directly on the wound. This is important to prevent any infection and to control the bleeding effectively. Don't be afraid to apply a good amount of pressure, especially if the bleeding is heavy. The pressure helps to compress the blood vessels and slow the flow of blood. Now, while you're applying pressure, it's helpful to elevate the injured area. Elevation works with gravity to reduce blood flow to the injured area. Think about it. Lifting your hand or leg above your heart makes it just a little bit harder for your heart to pump blood all the way up there. This can be particularly effective in reducing blood loss. This can help slow down the bleeding even faster. Elevation and pressure together are a powerful combination in managing bleeding. Keep that pressure on for at least 10 minutes. This gives your body enough time to form a clot and stop the bleeding. I know it can feel like an eternity, but trust me, it's important. 10 minutes can make a big difference in controlling the bleeding. Set a timer on your phone. Watch a quick video. Just try to keep your mind off it and let your body do its thing. Distraction can help you stay calm and focused. If after 10 minutes of direct pressure and elevation the bleeding hasn't stopped, or even significantly slowed down, it's time to call for help. Don't hesitate to seek professional medical assistance. Head to urgent care or A&E because you might need a little extra assistance like stitches to close the wound properly. Medical professionals are trained to handle such situations and can provide the necessary care to ensure proper healing. Now that we've got the bleeding under control, it's time to clean things up. This is a crucial step in wound care that shouldn't be overlooked. This step is super important to prevent infection, which can lead to complications and delay healing. Infections can cause a lot of trouble, from increased pain and swelling to more serious health issues. The best way to clean a cut is with cool running water. This helps to wash away any contaminants that might have entered the wound. If you have saline solution on hand, that's even better. But plain old water will do the trick in a pinch. Saline is gentle and effective, making it a great option for wound cleaning. Gently flush the wound for a few minutes, getting rid of any visible dirt, debris, or blood clots. This helps to ensure that the wound is as clean as possible before you move on to the next steps. Once you've given it a good rinse, you can use a mild soap and water to clean the area around the wound. This helps to remove any bacteria that might be lingering on the skin nearby. Be gentle. We're not trying to scrub away the injury, just making sure the skin surrounding the cut is clean. Harsh scrubbing can cause more damage and irritation. Now, I know it's tempting to reach for the hydrogen peroxide or rubbing alcohol, but trust me on this one. Avoid using them directly on the wound. They can be too harsh and cause more harm than good. While they're great at killing germs, they can actually be a bit too harsh and damage the healthy tissue, which can slow down the healing process. It's important to use products that are gentle on the skin. Remember, we want to create the best possible environment for our bodies to heal, and that means keeping things clean, but not overly aggressive. Gentle care is key to promoting faster and more effective healing. With the wound cleaned, take a closer look to assess the damage. This step is crucial to determine the severity and the best treatment. It might seem intimidating, but knowing what to look for can make a big difference in handling the situation. First, check for any debris in the cut. This includes anything that could have entered during the injury. Tiny pieces of glass, gravel, or splinters can get stuck. Remove them to prevent infection and complications. If you're not comfortable removing debris, see a doctor. It's better to be safe and let a professional handle it. Next, examine the edges of the cut to understand its severity and if it needs medical attention. Are the edges gaping open or do they fall together? This indicates if the wound can heal on its own or needs help. Can you easily pinch them closed? If so, the wound might heal well with basic care. This gives an idea of how well the wound might heal. If the edges don't stay together, it might need more than a bandage. If the cut is deeper than about 1/4 inch, it might require stitches or other medical intervention. If the edges won't stay closed, this is another sign that the wound might need professional care. If you see fatty tissue underneath, it's a clear indication the wound is deep and needs medical attention. It's best to err on the side of caution and get it checked by a professional. They can provide the right treatment for proper healing. They can assess whether stitches, skin glue, or butterfly bandages are needed to close the wound properly and minimize scarring. Proper closure is essential for preventing infection and ensuring the wound heals as neatly as possible. Now that we've assessed the situation, it's time to dress the wound and protect it while it heals. The type of dressing you'll need depends on the size and severity of the cut. For minor cuts and scrapes, a simple adhesive dressing might be all you need. Make sure the pad covers the entire wound to prevent it from sticking to the dressing and to create a barrier against germs. For larger wounds, you'll want to use sterile pads or a bandage to secure them in place. The pad will help absorb any drainage and keep the wound moist, which is important for healing. No matter what type of dressing you use, it's crucial to keep it clean and dry. Change the dressing daily or sooner if it becomes wet or dirty. This will help prevent infection and promote healing. Even with the most meticulous cleaning and wound care, there's always a chance of infection. That's why it's essential to be proactive and take steps to prevent those pesky germs from taking hold. These over-the-counter ointments help create a barrier against bacteria and can significantly reduce the risk of infection. But our work isn't done yet. It's super important to keep a close eye on the wound as it heals and be on the lookout for any signs of infection. Redness, swelling, warmth, and pain around the wound can all be signs that something's not quite right. If you notice any of these symptoms, or if you develop a fever, or see pus or drainage from the wound, it's crucial to see a doctor right away. That's it for our ultimate guide to wound care. I know it seems like a lot of information, but trust me, with a little practice, you'll be a pro at handling cuts and scrapes in no time. Remember, proper wound care is crucial for preventing infection and promoting healing. Always use safety equipment to prevent future injuries and seek early care for deep or contaminated cuts. So stay safe, be prepared, and keep those wounds clean and protected. Until next time, stay healthy everyone.